In our Healthier Me this morning, if you've ever had to undergo a medical procedure, you know the anxiety that may come with going under the knife. A product taking the medical field by storm is helping ease some of that anxiety for patients and is now available to the general public.
It's called Cover, and it's designed to keep patients covered up when they're wearing those dreaded hospital gowns before, during, and even after an operation. Brett Leone reports.
Anxiety, fear, panic, all the emotions you may experience as a patient rolling into an operating room.
I do a lot of hip surgery, and people are actually quite exposed during that operation.
And on top of that, you're naked.
Really during those procedures that I felt somewhat frustrated that we didn't have something better to cover the patients.
Nothing but a blue towel that constantly slips around to cover you up.
I turned to Heather and I said, there has to be a better way to do this.
That's when Mayo Clinic sports medicine surgeon Dr. Bruce Levy had an idea. Working in tandem with his wife Heather, the two designed an undergarment they call Cover to help ease some of the stress that comes with seeing a medical professional.
We've developed a garment that is basically an FDA-regulated Class 1 medical device that meets every standard and criteria for drape and gowns that are used in the healthcare settings, even the operating room, and we use it every day.
Patients are demanding it and saying, I'm not going to have surgery unless I can bring Cover in, or you bring it in.
Widespread use at Mayo Clinic began in 2017.
And now we're in numerous departments, medical and surgical.
And now anyone, not just medical facilities, can get one.
We're reaching all across the country.
Simple, yet effective.
So we're hoping that people will become aware of Cover and that we will raise the standard of care for patient privacy and dignity.
For more information on Cover, just head to our website, valleynewslive.com, and click on the Hot button.
A new government study reveals cervical precancers have declined since the introduction of the HPV vaccine. Researchers tracked rates of two HPV strains linked to 70% of cervical cancers.
They found the number of HPV infections and precancers dropped significantly among vaccinated women. About half of adolescent girls and a third of boys have completed the HPV vaccine series. Some startling new statistics about the drug epidemic in this country. The U.S. has more overdose deaths than any other wealthy nation, according to a study from the University of Southern California.
It showed drug mortality has now doubled that of Finland and Sweden, and the countries with the next highest death rates. The overdose epidemic is also affecting Americans' life expectancy. Researchers say the U.S. has lost the most years of life from drug deaths than any other high-income country. About 40% of mothers over 25 have a college degree. That's according to the National Birth Certificate data from 2017. It showed 25% of moms had a bachelor's degree and nearly 16% had a master's or other advanced degree.
Mothers in the District of Columbia were the most likely to have a college education, while those in Nevada were the least likely. More than 2/3 of Asian mothers had a bachelor's or advanced degree.